Good evening, everybody. How is everybody doing this evening? It is Wednesday. It's Wellness Wednesday here on the Victory Speak Show, and we are live coming in from Toronto. And of course, we have to start the show off with a little bit of music, a little bit of jazz to spice up your life. You're listening to From Whence We Came from Calabash, a little bit of Caribbean jazz led by Anthony Pierre. You got to pick up the album if you haven't already. Now get comfy, get your drinks, get your snacks. We're going to drop some wisdom tonight because we're talking COVID 19 and the vaccine. Share, share, share. Remember, sharing is caring. And for those of you who don't know me, I am Nicole Waldron, your voice of victory and your mental fitness coach. And welcome to the Victory Speak Show. And it's an inspired conversation series where iron sharpens iron. And that's you and me sharpening each other. And we are inspiring each other. And folks, I am on a mission to inspire you to live a life of victory. And so it's Wellness Wednesday. And on Wellness Wednesday, we talk about the journey of wellness. It's a journey physically, mentally that we have to make an intentional choice to do. And we cannot always do it alone. And in this series, we want to focus on not just our physical health, we want to do it on our mental health. And one of these things that I found myself doing is that I realized that I started advocating not just for myself, but for others when I found myself in the medical world. And whether it came down to sickle cell, whether it came down to, cancer, mental health, no matter what it was. And I figured it was time to start bringing of the individuals that have been around me into your life. And so you can learn some of the things I have learned from them along the way. Tonight, my guest, I tell you, I am so excited by my guest who has worked and advocated for thousands here in Canada and globally. And during the pandemic, he has been given a task that was, my God, tremendous, and he's still working on it. My guest tonight is Dr. Akwatu Khenti, and I'm going to tell you a little bit about him. And I stress little because his resume is full. It's like a full course meal. So he is a special advisor to the City of Toronto's targeted COVID equity action plan and the chair of the Black Scientist Task Force on Vaccine Equity. He is also an assistant professor with the Lana School of Public Health at the University of Toronto and an advisor to the School on Equity and Inclusion. He is also an affiliate scientist at the Institute for Mental Health Policy Research at CAMH. He is formerly the Assistant Deputy Minister for the Province of Ontario's Anti-Racism Directorate, as well as CAMH Director of Transformative Global Health. Now, just a little more information about him. He's coordinated the Working Group on Community-Based Treatment at the United Nations Office of Drugs and Crimes, with diverse and influential stakeholders from 7 distinct world regions, and also co-led the Drug Research Capacity Building Institute, involving academic leaders from 10 universities across Latin America and the Caribbean. He's also worked with diverse and influential stakeholders across multiple primary healthcare centers to negotiate and implement center-wide stigma strategies, programs addressing implicit bias, persistent conflicts, and staff motivation challenges in the face of considerable participation disincentives. As chair of the task force, he brings his expertise in anti Black racism, mental health, and the adaptation of mainstream health interventions to African and Caribbean cultures. Okay, Victory Tribe, do me a favor. Show some love. Show a warm welcome with your emojis, with your hearts, with your comments for a champion of equity, diversity, and inclusion. I'm going to bring to you the one, the only, Dr. Akwatu Khenti. Woohoo! We're going to bring him up here now to you. If it will only up, if everything could cooperate. There he is. There he is. Wait, Akwatu. I got to give you the round of applause. Got to give you the round of applause. Woo! We gotta bring you up live. We gotta bring you up live. We gotta make sure that you are welcomed.
Very nice. I appreciate that very much. It's a privilege for me to be here tonight, this evening, I should say, and I'm looking forward to the conversation.
Well, I tell you, Sarah Oyango is already tuned in from Ottawa, and she is looking forward to this conversation. So the question is, where do we start? And I think we should start with you because you're on the front lines, Akwatu. How are you doing and how have you been handling being on the front lines and working in this pandemic?
Well, I think during a pandemic there's no greater privilege than addressing the pandemic, than working to sort of mitigate all of the harms, the potential harms, the health harms for Black people of the pandemic. And there's been a lot of racial disparities during this pandemic. We've been overrepresented in positivity, overrepresented in hospitalization rates, overrepresented in death, mortality rates. So for me, I couldn't ask for a bigger job and a much more, anything more significant for me personally than to be able to bring all the experiences I have, the expertise that I have to sort of to bear on the challenges that are facing African Canadians living in the province of Ontario, especially those in the city of Toronto. Because the disparities that we're experiencing in COVID doesn't stop at the borders of the GTA. It goes right across the province and right across the country. But you address what you can. I'm not hearing you.
My apologies. I muted myself. Look at me.
Okay.
I want you to talk so much tonight. I muted myself. And Joan Pierre is like, I can't wait to learn from this well learned friend. So we want to learn, but I think people need to learn a little more about you. And tell us, why did you even get into this world of science and mental health? What is that? What is your background? Give us a little snapshot of you, Akwatu, that I
Yeah.
can't read in 4 pages of who you are.
Yeah. So I actually didn't look for mental health. I didn't look for COVID or vaccines. My life story and my career really has been a question of, it's really been opportunistic. Things come along. I'm doing one thing and somebody says to me, Akwatu, you want to try this? And I say, that sounds interesting. Yes, I will try this. And one thing always leads to another. That's how my
Mhm.
career has evolved. But the one thing I could say is I've worked on my passions, whether it's slavery in Africa and the African diaspora, the horrors of the civil war in South Sudan, human rights situations, education rights, policing, criminal justice issues. I've just been moving from one of these things to the next, but they're all interrelated. And but for ending up in mental health and addictions for 20 years, that was a kind of a news to me. But one of the things is people from our background, we live with a lot of trauma, and we don't recognize it as trauma. We don't even, it's just normative. It's just normal. And I grew up, my dad was an alcoholic, I had a lot of situations, poverty and everything like that. But it never even occurred to me, man, you're dealing with so much. And but faith brought me to this mental health world, and I was able to sort of grapple with many issues that my family had never grappled with because we just never thought of it, and we didn't have the time to grapple with anything because we were so busy surviving,
Yeah,
right?
yeah,
And
yeah, yeah.
me being able to support others and work with others and work with communities is my therapy. Let me put it that way. It's therapeutic for me because I'm addressing the ghosts in my own closet and the baggage that we all have coming out of the conditions that we lived under without even, we never had psychiatrists to study the mental health um, consequences of slavery. Tell us,
Right.
man, you've been enslaved for 275 years. You're going to have these problems. This is what you need to do. No, nothing like that, And then go through second class status for 100 years, more pressure, more problems, more distress, no mental health help. In fact, people didn't even think you had mental health issues because they thought we didn't have a mind to appreciate our conditions. And so, yeah, this is all new, but it's all important. And it's all interrelated. Our mental health issues related to our socioeconomic issues, related to our lack of political representation, related to our lack of respect, the dignity that we have in the world as Black people. All of these things are interrelated and sort of put us in the place where we are globally. But the good news is it's changing. our situation is improving.
Right.
Our demographic reality is being transformed, even as we face some of the old problems. New problems are emerging. We also have new strengths, incredible creativity, which we've always had, which has allowed us to survive. But we're going to be in a different place post pandemic, post this current world order. We're going to be in a better place. African
What
people.
and and I like I feel like we have to have a conversation where we bring you back with a couple other people to really speak about mental health and what being enslaved has done to us, because I think that history and that background will really serve to help others understand where we come from. We are doing it with other communities, but we really have not been having these robust conversations so people can really understand why we are feeling the way we're feeling, dealing with the things we're dealing with, and ourselves as a community. A lot of even the young people don't understand our history and why the mental health disparities are happening. So I'm so happy that you brought that up tonight.
Yeah. Parenting. You see, um, the key is parenting.
Hmm.
Understanding what parenting is from an African centered point of view, learning how far we are from that African centered point of view in
Mm,
the way that we parent. We think parenting is discipline, you know, you know, and it's not discipline. People. That's what we because that's what we sort of grew up to think, harshness. That
yeah,
it isn't like that in Africa. It isn't like that. And you talk to children, you reason with children, you explain to children. You don't just rush to discipline them or give them licks and all them kind of thing. And that's the slavery experience, which has sort of transmuted into this form of discipline because we don't want our children to endanger their lives. So yeah, and we gotta get. And I don't know. I don't have the solution, but I know what the problem is. I think that we have a lot of baggage coming out of that enslavement, and indigenous people refer to it as intergenerational baggage. I'm not sure if it's intergenerational, but it is a problem for us. Yeah.
yeah, yeah, totally. And I think when you mentioned that in Africa, discipline is not done the same way, but somewhere along the line, the misinformation has come in, and we don't realize it's the effects of being enslaved that has caused us to start disciplining our children in a different way. Man, that is a conversation. Woo! You're opening a can of worms here, Dr. Akwatu. You're opening a can of worms here tonight.
Yeah,
And
no, no, I understand. The stuff like I said, it's all interrelated, and COVID too. One of the so I can actually just
yeah,
segue into COVID
yeah.
because one of the biggest challenges we're going to have coming out of COVID are the issues of children and adolescents having been cooped up, having effectively lost a year to 2 years of schooling
Mm,
and socialization, and how do we as a community who have actually prior to COVID we were already challenging the education of our children. How will we sort of accelerate their learning process so that they can catch up afterwards? What will we do? What will we do as a community to ensure that post COVID they're not hamstrung in the race, like one leg,
yeah.
one hand and one leg. When we used to have that race where you used to have to tie
The
your
three-legged race, the three-legged
yeah,
race.
yeah,
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 yeah, yeah.
yeah.
Yeah, we don't want that yet, right? We don't want that.
No, we
But we
don't.
need to decide. We don't want that. We need to decide what will we do. Not just ask other people to do, but what will we do as a community to address this huge issue, which is, to me, that's one of the burning issues coming out of COVID.
So we literally have to have, I don't know, well, we're going to have to talk about that, because how do we address this as a community with the educators, with, the leaders? What do we need to do? Sometimes we talk, and we don't do anything. So, what do we do? And, as I start to think about this, let's go into the task force for a hot minute so people can understand what the task force is, because I think even out of what you just said, that really shows the work of the task force, of some of the things, the findings that you will have established from the task force. So why was the Black Scientist Task Force formed, and what was its purpose?
Yeah. So the Black Scientist Task Force was formed um, last year when city officials realized both the enormity of the COVID challenge that um, was falling upon Black people. They were 33% in last August, 9% of the population, 33% of COVID positive folks, which is a huge disparity. And on top of that, having the largest rate of vaccine hesitancy in the country. Vaccine hesitancy means people who have access to a vaccine but choose not to get vaccinated. That's the World Health Organization's definition of vaccine hesitancy. So that was the problem. High positivity, low willingness to get vaccinated. And so people in the city wanted help, wanted to sort of address this. And, they asked me how to address it. And I said, we need to have trusted sources, trusted expertise on vaccines, speak to Black people about vaccines. We can't have white people talking to us about vaccines because it's going to go in one year, come out the next, or fly like water in a dog back. You understand?
Yeah.
Meaning we need to hear from people who can be trusted. People will take what they're saying seriously and pay attention to it.
But
And
tell
that's
us
the
who was,
idea was born.
and I'm glad you said that to them. So who was involved in the Black Task Force? Because you had scientists and you had some other partners. Who was involved in the task force here?
Yeah. So the people who are involved in the task force are people who are involved in the life cycle of a vaccine, from clinical trials to regulatory processes that a vaccine has to go through in order to be approved, the quality control issues related to how a vaccine is manufactured, to post-manufacturing issues in terms of allergic responses of people, how that's dealt with, how that's understood. So we have people across the life cycle of a vaccine who can speak to any question about the vaccine, and they're all Black. And that was the goal, having such people who have expertise in the area, and it's recognized expertise. It's evidence-based, what they call evidence-based understanding. It's not, I read a book and I get it. No,
Yeah, yeah.
I've produced vaccines. I've dealt with people who have allergic reactions to vaccines. I've saved lives. I've done this. I've done that. So that's what we have. And it's been an amazing learning experience for me because I'm no vaccine expert. My expertise is in public health and
Right.
health equity and gun violence, actually, not vaccines. But the lessons of those areas are all relevant to the lessons of vaccine mistrust. One of the first lessons is that the framing of the problem is challenging because while we share many concerns with non-Black communities, particularly around safety, particularly around the rapid way that the vaccines were produced,
Yes.
we have an issue that only Indigenous people have: historical mistrust.
Right.
That's an issue. That's a Black issue, and it's also an Indigenous issue for reasons having to do with colonization as well as other things. But we've been guinea pigs. We've been exploited. We've been in situations that we shouldn't have been. Not just Tuskegee, but other vaccines in Africa, meningitis vaccines in Africa, polio. But the situation was reversed with polio. They didn't want to give us the vaccine. They didn't want to vaccinate Black people. So it's putting all of that together and being able to explain to people in our community that you have a reason to be mistrustful because that mistrust has served you well. And no
Right.
one wants you to stop being mistrustful because your survival depends upon your own decision makings and your own reliance on your community instinct, your instinct. That song right, something wrong.
Yeah, yeah, yeah.
You got to keep that common sense. You got to keep that intuition going, right? But at the same time, don't be anti-science. Don't act like if Black people haven't been involved in the scientific progress around vaccines. We've been. And the problem always is our expertise and our contributions get rolled over and forgotten and lost and submerged and all that stuff. But we introduced vaccines to North America. Not quite the same thing. They call it variolation, which is in 1721, African name Onesimus.
Right.
That was when you just scratched the person who was sick.
Right.
The pus or the pustule. And you go around the village sticking healthy people. That's the concept. Inoculation, coming from Africa to North America. Of course, the African who brought it got no credit, no money, no copyright, no patents,
Right.
and actually continued to live in slavery. He wasn't freed for his contribution and thought or whatever. But and throughout since then, there's been others who have been part of the vaccination story, and we need to know that so that we don't take on this anti-science approach that has nothing to do with us.
So
That has to do with some people who decide they want to be anti-science. Well, they can afford to be anti-science, but we can't afford to be anti-science. Black
and
people.
it speaks to the power of history, because the history has been so hidden. Now what you're saying there is, and I mean, I'm learning stuff tonight, and we talk so much. I'm learning more stuff tonight, that in terms of the scientists, and hearing what came out from Africa. And as the more and more we learn, the more and more we realize how much stuff has been hidden in our history. And if people were to realize the scientists that are black, that are involved in medicine, and the triumphs that we've made, they would probably look at things a different way. So in these town halls that you had, so you had some town halls. How many of these town halls did you have, and where can people, because I mean, you have a plethora of information. You had various scientists and people in the field talking. What were some of the things, and where can people find these town halls to get some more information on the vaccine? Because I know we can't say it all here tonight,
Yeah,
because we had a few.
TorontoBlackCovid.com. You have
Hmm.
all the town halls there. You can access all the town halls that we've had. Um, yeah, right? TorontoBlackCovid.com. It's all there. Check it out. It's free, no subscription required. Access those videos, and we've had different themes. We've had different kinds of conversations, because we've had conversations with occupational groups like childcare workers, shelter staff. We've had different communities, Black LGBTQ communities, Black queer youth. We've had university students, Black farm workers, Caribbean seniors, Caribbean Catholic Church, Black Canadian clergy. So we've tried to cover all the segments of our communities. The only segment which I haven't been able to get full access to are the incarcerated population, but I want to. We want to. When it all is said and done, for me, it's important that there be no stone unturned, that we have reached and try to reach every segment of our community, because all Black lives matter. Free,
Yes.
incarcerated, living in the home, homeless, all lives have to be valued, and we have to do our level best to make sure that everyone understands the risk. Because you might be homeless today and have a house tomorrow,
That's
you
right.
have a shelter, and your life takes on a different meaning, stability, your mental wellness, just like that. And it's amazing. I knew a guy who lived on the street for about 30 years. 30 years. And one day he was walking past this recovery place, and this is a guy who everybody tried to get him to go, get rid of his addiction. He gone through a kind of addiction. He ended up in prison. Come on. And he decided, just one day, boom, I want to live homeless again. Just like that.
Wow.
No, no lightning and striking or anything like that. A guy named Michael, and it's been 25 years since he's changed his life around, and he never go back to the streets. So all things are possible, and we have to give everybody a chance and give everybody the respect that their life deserves.
Yes, we do. And thank you, Sarah. Sarah has put in a comment that scientific history has been hidden intentionally to affirm and maintain so called white superiority in the field. Yes, it has. And so in the town halls, you had about 20 town halls, you had over 6,000 people participating. Is there anything that struck you in particular, when you were in the town halls, from the different individuals?
Yeah, a lot of things struck me. Um, one of so which one do you want?
You go ahead. You go
Eas-
for the goal. Go for the goal.
the easy strike or the hard strike?
I
Anyway,
want both. I want
yeah,
everything. I greedy
yeah.
tonight. I want everything.
One of the things I was struck by was the fact that a lot of our health professionals who are educated had some of the same trepidations about the vaccines as people who are less educated. like people, farm
Wow.
workers, for instance. Health people who are nurses and working in primary care, and they have master's degree, tell me they're taking the vaccine for the same reason a farm worker with a high school education, but offered the vaccine and taking the
Hmm.
vaccine. Same issue. And the issue really was, and I mean, there's many different variations of the
Right.
argument, but it will affect your fertility, instill a chip in the DNA, kill you. At first, they thought it would kill you right away, but then after a while, the narrative has changed. It will kill you in 3 years. So you get a vaccine that's going to kill you in 3 years. And there's a lot of those kinds of misinformation out there about the vaccine, which um, we had to address scientifically to say this is possible, this is impossible, this is highly improbable. Probably, maybe in 20, maybe in 100 years, they'll be able to put a chip that controls your thinking and your behavior. But right now, the technology doesn't exist. And just on that note alone, be able to address those kinds of ideas that people are getting off of social media and
Yeah.
taking it as seriously as they take science-based information about the vaccine. And so that was um, one of the things that struck me. And a lot of people who were at risk, who were in the risky professions, they're actually working in these old folks' home or long-term care situations or home care, where they actually expose the people who are potential COVID positive and still not getting vaccinated, even though they're working with a higher risk population.
And they're seeing people dying.
Yeah, and that's I'm seeing people die and still not extrapolating that their life is at stake, not just their perfect occupation or their yeah.
But
It's
that means that the mistrust is so high then, Akwatu. Like how do we these myths that are out here in terms of you're gonna get a chip, you're gonna have your all the different things I've been hearing. There are lawyers who are, I heard today that a lawyer has been sending emails to people and telling them don't take the vaccine. Like how do we deal with some of these myths? Where do we get some of the true information on the vaccine?
yeah. So yeah. So we all you can do is really um say, okay, this is what you're putting out there. This is the reason why you're saying don't take the vaccine. Let me walk you through what has to be involved in what you're saying for that to work. What would how would you have to be able to alter um, the DNA of someone with a vaccine?
Right.
Like and can the mRNA vaccination do that? And this is why it can do that, because it just touches the surface of the skin. You understand? And you're talking about the brain, altering the brain,
Right.
and you have to actually go into basic biology to show why certain things can work and certain things can't work. And vaccines actually just use the body to trick itself that the virus is coming, and then create antibodies to defeat the virus. And that's basically you're tricking your body. And you have to trick your body for some issues. You also have to trick your mind for some issues. People who are
Right.
addicted have to trick their mind to defeat the addiction, because your mind will actually take you to places to feed your addiction, even though you tell yourself, I ain't doing that. You say, I'm not walking past Young and Bloor, because if I walk past Young and Bloor, I'm going to see Jerry. Jerry has drugs. We're going to get high, and I'm going to end up sleeping in a park downtown with Jerry or something like
Right.
that.
Right.
And you tell yourself, here, me, I ain't going by Young and Bloor today at all. you know, yeah. Next thing you know, you're going to the subway, you're in the subway, you say, Jesus Christ, I forget to pay that bill by the bay at Young and Bloor. I forget to pay the bill at the bay. I can't let that bill pass. I go and pay the bill. Next thing you know, as Young and Bloor, paying a bill that's meaningless, because you're gonna pay it online, but your
Right.
brain actually tricks you into putting yourself at risk to feed your addiction, right? So you have to actually learn how to trick your brain to say, if I feel like I had to go and pay a bill at the Bay and Young and Bloor, I should call Jerry. This is the time to call Frank or call somebody else to say, could you meet me and let's have a coffee, because I really feeling the urge, and I think if I'm by myself, I'm going to actually feed that urge, So you trick yourself into doing the right things to sort of prevent
And it's
your
like
fall.
shifting you have to shift your
Yeah,
perspective. So it's
yeah,
like shifting your perspective in the body with the vaccine. The
that's
vaccine does
correct.
a shifting in
That's
the
right.
body. It's shifting the blood cells to believe something differently, and so then it starts to work
And
inside of the body. I'm not a scientist, but I think I get where you're
that's
going.
what it is. That's what it is. You get prepared for battle. You have your blade out.
Right, right,
Once you
right.
get a gunfight, you have your weapons. You're ready for the incoming insurgents or whatever they come in to take over your immune system or whatever. You want to kick some butt. So you all, whereas before you might be sleeping, all of a sudden the virus coming through the window, and you say, "Well, what do you have? I like a virus." Too
Yeah,
late.
yeah, yeah, yeah,
Virus
yeah.
in your house already. You understand? Yeah.
And that is the thing. It's this virus is so confusing because you see so many people just walking around. They're tired. But when we look in the Black community, these narratives that are going around, what else are you hearing in our community in particular, especially when you think of our history and you mentioned some of it before, especially when it comes to being used as guinea pigs? How do we combat or deal with this? Because it's not here that we're trying to tell you that we want you to take the vaccine. We want you to understand what is happening you so you can make an informed decision. So I want everybody live on the replay tonight. This is not about saying you have to take the vaccine. This is about giving you information so you can make a decision. So when we look at what has been happening, um, let's go over some of this, the cultural stuff that is really causing this conundrum, with people not wanting to even entertain the thought of taking this vaccine.
Yeah. So what we do is um, outline the protocols, the safety protocols the vaccine went through, even though it was an under emergency authorization. The vaccines, all the four vaccines that are approved in Canada, had to go through to be first in the United States and then here to get approval for use. It had to be safe. The manufacturing had to be um, well developed, well understood, all the protocols in place, and the scientists had to say the advantages outweigh the disadvantages. So we have to demonstrate the safety of it. That's number one. We also have to show what went into the vaccines. And when these vaccines were developed, even though they were developed rapidly, and people think they cut corners to develop the vaccines. They didn't cut corners to develop the vaccines because they just used all the resources that were available that had been going on for about 20 years when a vaccine was being developed for SARS. They developed a vaccine for SARS and were very close to clinical trials and all that, but then the market disappeared. But they had the technology, but no market, so which means no money. But what happened was with COVID and it being a global pandemic and lives of the high income countries being at stake, not lives of the world, but lives of the high income countries, money was thrown at the problem in a way that never happened before. And that's the irony of the situation that you have to understand. The reason this vaccine was produced expeditiously or as rapidly as it was in an unprecedented historic fashion is simply because lives of people in high income countries were at stake, which include our lives because we live in a high
Yeah,
income country.
yeah. Money
That's the big
talks.
thing. Not Africa.
Money talks. Money talks.
That's right. And not South Asia, not Latin America and the Caribbean. Not the Western Europe, North America, Japan, and coming up there, China too. Although, so resources were thrown at the problem. And when you
Right.
throw resources like you threw billions of dollars at the problem, people get resourceful, and that's what happened. And so the vaccine was produced in a way that's methodologically sound, that
Right.
can stand up to scientific scrutiny, which is what we have. We actually looked at the data ourselves, not me, but the people who are on the task force who have that level of expertise. And it's like reading Latin or something like that. You have to have the ability to be
Yeah.
able to understand what you're reading and say, yes, the clinical trials would involve about 10% black, which was also unprecedented.
Hmm.
We never had a situation where there was so many black people in the clinical trials before. not for Tylenol, not for any previous vaccine or any previous medicine. We never had that level of representation before. And it's so surprising that even with that representation, we have such a challenging issues because we've been vaccinated. We've been taking vaccines before. We all come to this country, those of us who are immigrants, vaccines. I have my mark here on my
Listen.
arm from childhood days.
Yes. Yeah.
I'm from Trinidad because you see my little vaccine there.
Yeah.
So, but yeah, so those corners weren't cut because they had money. They could build new roads. They didn't have to cut no corners. They built new roads to create this vaccine, and the vaccine is really um, superb in terms of vaccine efficiency and vaccine efficacy. We're talking 90%. We never used to have that before. 95%
Hmm.
effectiveness in the real world from a vaccine. This is unprecedented, and so and what so that's one thing. And the other thing that surprises me is two things. First of all, we have some people who really appreciate the equity issues involved in globally. That the fact that many of our people in Africa don't have access to vaccine. In fact,
Right.
most of Africa, the African region right now is the most under-vaccinated region in the world. About 175 doses or something like that per 100 per 1,000 people or something like that. I forget, but anyway, lowest vaccination rate in the world, and we have COVID exploding in different parts at the same time in South Africa, Uganda, and we have to be cognizant of our responsibility to our people in Africa as well as the Caribbean, Latin America.
Right.
It's a global. The Black struggle has always been a global struggle, and advances in one part of the world fuel advances in other parts of the world. And when you lose and you go backwards in one part of the world, you also go backwards in other parts of the world. So what's happening in Brazil with Black people affects what happens here with Black people. When they lose a struggle, lose a battle, lose a war, we lose a struggle. We don't even know how the chips fall. We don't even know.
Yeah.
Leave you me, they do. When we win, the victories percolate,
Right.
cascade outwards. Like, I mean, one of the biggest victories was when Haiti, Hispaniola, when the Africans in Haiti, in Hispaniola won that whole thing cascaded outwards, and that's what actually led eventually to the abolition of slavery. So when we talk about emancipation, Juneteenth or the August the 1st,
First. Yeah.
we must. It's hot. You got to remind people. We got to go back to 1804. That's where it all started, really. But then even when you think 1804, you got to go back to Palmares in the 18th century in Brazil, because whenever Africans won, it inspired other Africans to fight and to fight on, and that's how it goes, right? So we have to remember and think like that when we see the struggle in Africa just to have equity on vaccines, right?
You
I'm
know,
going all over the place, but forgive
but
me.
no, but it makes sense because one of the things that comes to me, and sometimes I'm a different kind of conspiracy theorist. I go like, okay, if you continue to go on the rumors and the misinformation to the Black population, or you play on their fear, because there's a lot of fear in our community about it. It is reaching the continent in such great ways that they don't even want. Because I remember what was happening in Tanzania, right?
Yeah,
And now the president, I think he's deceased now, and now they have to change because they were telling people that COVID wasn't real, and they weren't giving any vaccines. And so the myths and the misinformation, I think sometimes the misinformation that we've been getting has not really only started here in our Black community. It is coming on social media in such waves that we just want to believe that everything is wrong for us, and now it's killing us in a different way with the misinformation. But I digress. I
no, but
digress.
no, that's true. Misinformation um, isn't good. I mean, like there's nothing to learn from misinformation except that the big lies always have a kernel of truth in them.
Yes. Yes.
What gives them currency. And the bigger the lie, the better the lie. But you have to have a kernel of truth. I remember the calypso. I don't think he did. Lord Nelson, when he had a
Lord
calypso,
Nelson.
lion, the
Yeah.
liar, the liar, and he had a lion competition in Trinidad. the bigger the lie, the better the lie, because it's harder to disprove. The bigger the lie, the harder it is to disprove.
Yeah, and
And so,
we have to know our history. And yes, Sarah, we saw the report the other day that what is happening in Uganda is really bad. You know, Sarah is also asking here, Akwatu, what role could the church play here in Canada to boost vaccine acceptance?
yeah. So, I've been having a discussion with church pastors. I've attended several prayer meetings. As a man, I haven't been to a prayer meeting since I started to go to church, you understand? But lapsed Catholic, as you will. But I've been attending several prayer meetings and talking to pastors and encouraging them to get off the fence. Because what
Hmm.
the pastors, many pastors have been doing is saying, it's your decision. Even
Right.
though most of them getting vaccinated, but it's your decision, because many of them, their flock, people in their congregation, are vaccine hesitant. They don't trust the vaccine. They don't want to get vaccinated.
Hmm.
And I even had the emergency room doctor email me over the weekend saying that, the emergency room things starting to ease up a bit, but they're seeing unvaccinated black people, many of whom go to church. And this is a Muslim doctor who tells me that, do I know? And I
Right.
put him in touch with some of the black clergy to see if they could sort of figure out whose church these people go to. But yeah, so you know, you, what we've done with black church leaders is sort of share with them the information, the science of the vaccines, and also tell them that you know God is the one who grants knowledge. I mean, like
Come on now. Come
yeah,
on now.
all knowledge is inspired by the sacred or the divine. However you imagine that.
Yes.
That's why you had it. You didn't know yesterday, and you know today. I mean, like, what's that? You're walking
Hmm.
down the street, you're gonna. Where did that come from? Anyway, um, one of the surprising things, which has been good for me too, is to learn the theological arguments from the church leaders why it's not the mark of the beast. It's a common one amongst churchgoers why they wouldn't get vaccinated, because it's the mark of the beast. So the church leaders had to explain to me that it can't be the mark of the beast, because according to the New Testament,
Yes, the New Testament revelations. Yes, yes, yes. You're good. You're good. You're on. You're all
yeah,
right.
yeah. According to that, it have you have to be willing. You have to know when you have to declare yourself for the Antichrist. That's number one. Mark on your forehead and on your right arm, I think it was.
Right.
You have to. It has to be an people people have to accept the mark of the beast. They have to say, I want the mark of the beast, and there's nothing like that in the vaccine. There's no acceptance of the devil or the mark of the beast or the Antichrist. I mean,
And some people, and it's part of the rumor with this, and I'm glad you're saying this. I remember hearing somebody say about the numbers in the vaccine. Some number in the vaccine has a 666 in it, so therefore it's the mark of the beast. The rumors are endless, and I think if people are hearing what Akwatu is saying, the church leaders have to start speaking up, because even if you don't want to say to take the vaccine, tell the people the truth. Whether you're Muslim, whether you're Hindu, whether you're Christian, whatever you are, you need to start finding the information and telling them the truth. Um, and if they don't want to, Joan Pierre coming up on the rear here now. These pastors will answer in that way. They don't want to lose their flock. They're not true leaders, and it's true. And the thing is, if you don't want to lose the people in your church, you need to tell them the truth. Are you so busy wanting them to be in the church that if you're telling me now what is showing up in the hospital rooms in the emergency are black community people who are from the church, and so now it's going to start ramping up in the church as people start going back out there. So that to me is of great concern. And there was another question somebody sent in, a question saying, does the vaccine work differently on black people than others?
no, it doesn't. And well, there's two ways of knowing that 9% of the clinical trials were black, and no sort of racialized patterns emerged. Number one, but also, even though we need representation in these clinical trials as an assurance of the
Hmm.
of the whatever it is, the pharmaceutical or the vaccine or whatever. You know, you gotta know genetically, white people who are so-called white or blacks are the same genetically, and there's more difference between ethnic groups in Africa 100 miles apart than there is between blacks and whites or blacks and Asians abroad. Genetic diversity is the hallmark of African life because humanity evolved in Africa for 100,000 years before they left and started populating parts of the world.
Right.
So don't expect significant differences between Asians and Africans and Europeans abroad in clinical trials. I mean, there's differences in terms of medication and the dosage that's required for Black people because of melanin and all that kind of stuff.
Mm-hmm.
But genetically, there's very little distance between people who are Black and people who are white and people who are brown and people who are yellow. There's more differences between Black and Black in Africa than there is between Black and brown and yellow abroad, because that's where humanity evolved first. And if there's going to be any differences that are biologically um, driven, it's going to be between two ethnic groups who have a huge genetic differences because they've evolved for 100,000 years. Like in the Nuba Mountains of South Sudan, for instance, guys live on a mountain, mountains apart, and
Right.
I mean, like they just they don't marry each other and all kind of thing. And that's how they grow, right? And they've been like that in Africa for thousands of years, and that's where you find genetic diversity. Africa is the sort of the I don't know what to call it, but that's where you have the richest source of genetic diversity in the world.
So I know this gonna sound funny, eh? But I want to go on a vacation, and I want to go on a vacation in your head. I want to sit and have a conversation with your brain.
Take a
You
life raft.
you know what I'm saying? And sit down and have a conversation with your brain. Um, that's a good question, Sarah. Can you talk a little bit about the role of supplements in helping our immune system fight COVID-19?
Yeah. So supplements, whether it's vitamin A, D, B, um, are good. It's not either or, and but supplements can't help you fight a virus. Supplements can strengthen your ability to sort of recover faster than you will otherwise, but it will not fight the virus for you. But it will. It's good for you. It's like exercise. It's good for you.
Yeah.
Exercise
Yeah.
is good for you. If you exercise and you get the flu, you have a shorter time span with the flu, especially if you keep exercising than if you don't exercise. You understand? But it won't stop the flu because the flu is a virus, right?
That is really good information. And as Sarah said that, and I know we talked about zinc and stuff before. Um, there's some of the confusion because there's so much confusion coming out of the media every day, right, Akwatu? So now we have all the challenges in the Black community and the Indigenous community about what we've experienced in the past, which is true, the different trials and how we were used as guinea pigs, and then all the misinformation. But now we said take Pfizer, take Moderna, take AstraZeneca. Then you have to get the same Pfizer shot. Now they're saying, okay, mix it. You could mix Pfizer with Moderna, or you could mix Pfizer. Tell us now, because I know some folks calling me and saying, I not mixing Pfizer with Moderna. I waiting for Pfizer. What do you know, and what advice have you been getting from public health on this information here?
Well, I've been getting the same advice. I'm getting the same advice you're getting. And, I shouldn't sort of go back into the Trinity there, but yeah, I'm getting the same advice you're getting, and it's confusing because the messaging is changing, and it tells you there's a problem in the messaging, and which could be a good thing. But remember, we're in a pandemic. We've never been in a pandemic before, where things keep changing every week, and you're getting new information every
Right,
week.
right.
And COVID is mutating. So there's new COVID. They got COVID, the Delta,
Yes.
and then now they have the Delta Plus. I mean, so that's easy. So that's one. But So the Moderna vaccine and the Pfizer vaccines are similar type vaccines. They're made with the same technology and
Right.
they're doing the same things. So those two vaccines to me are interchangeable to us. It's not like AstraZeneca, which is a traditional vaccine, or the Johnson and
Yes.
Johnson vaccine. So yeah, so but what the vaccines do, all the vaccines do the same thing: trick your body into producing antibodies. But one does it with a piece of the virus, right? And one does it with a code for the virus.
Oh,
So,
okay.
but the idea is the same: tricking your body to produce antibodies. Now, when you get sick, you produce antibodies. So, if you get COVID, you produce antibodies. The challenge is we don't know how long the antibodies will last, and we don't know how effective the antibodies will be against the variants. So, if you get the UK variant, you get sick, you get better. When you get the Delta variant, actually, there are a lot of studies that show you get it, because some people say they get COVID 2 and 3 times, right?
Right.
But you don't want to get COVID 2 and 3 times because you don't know how your body will react. You don't know if the
Right.
third time is the last time, because the next time is a severe COVID, or this time you didn't even know you had COVID, no symptoms. Next time you're flattened, you can't pull yourself off the bed, you can't get out of the house because you're
Right.
just down on the ground. You need air. You need to. You
So,
need
what
to
is the advantage of taking the vaccine versus not taking the vaccine?
anti so they say you're 30% effective against if you have your first vaccine, you're 30% effective against the variant.
Right.
um so you know what I mean, like, so certain decisions had to be made. So one of the decisions they made was spread out first dose, try and get as many people get a first dose as opposed to just focusing on the vulnerable populations, and make sure they get both doses, because both doses uh, maximize the strength
Right.
and your antibody response and your protective forces, right? But the scientists decided, well, that's one way, but because we weren't certain about when we are going to get supplies at first, they weren't sure when the
Okay.
supplies was coming. They decided, you know what, in this situation, we're not too sure about the supplies, but we have all of these doses. Rather than hold some to give people their second dose, let's just give everybody, as many people as possible, a first dose, and that's what they did.
And that's the herd immunity that they talk about,
They want
trying
to
to
achieve
create some
herd
of the herd
immunity.
immunity. Right.
If you want to achieve herd immunity with first dose, you had to give people second dose to be fully
Okay.
vaccinated,
Okay.
right? And fully vaccinated is the best defense against the variants, being fully vaccinated, and that's why they're willing to mix and mingle the vaccines.
So then they can open
Technically,
up.
it shouldn't be a problem technically, because you're tricking the body, right?
Right.
Again, we're in it, but the trials are underway. And this is it. We're facing the pandemic now. So England was coming out of lockdown, but now they have to go back into lockdown because the Delta variant is hitting them so hard. But so they have studies about mixing that show that
Right.
it's effective, and that's we're learning from them, and that's why they said, okay, you better. It's in our best interest to do this.
So it protects the population. One, I think one of the things that I recognize too is even though you get the vaccine, you still need to wear your mask because people are walking around and you don't know who's vaccinated, you don't know who's asymptomatic or whatever it is. You should still be wearing your mask.
Yeah, because no vaccine is 100%.
Right.
There's no 100% vaccine. So, and that variant, like I said, the Delta is more infectious, and the sickness is more severe. So we don't want to tackle that if we don't have to. And I
Yeah.
remember, black people, because of systemic racism and the social determinants of health in the West, in the
Hmm.
Western Hemisphere, we all have in the Western Hemisphere disparities in chronic conditions. We all have higher rates of heart disease, high blood pressure, asthma, diabetes
Right.
than is ought to be the norm, and that actually applies to us across different socioeconomic levels. So we,
Hmm.
you know, because we have a lot of wealthy black people and they have high blood pressure. Say, how come you have high blood pressure? You're making all that money, man. What's going on?
Yeah. Yeah.
Educated, pH 10 degrees, and high blood pressure, heart disease. Because all our, all the money and all the education can't protect you from the systemic racism in the society, which we face from the time we're born until the time we die in this Western Hemisphere, right? And that's a source. The concept is weathering, biological weathering. That's what leads us to having more of these chronic conditions. And we know because in Africa they don't have those chronic conditions to the same degree. That,
Really?
yeah, the prevalence is far less than it is in the Western Hemisphere. So we know it's not genetic or biological. But anyway, those chronic conditions are what
I am. Wait,
COVID
wait,
might.
wait, 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 wait. You can't just say that and just run away. It's when you say it's not genetic and biological because that's what we're being taught all the time.
Yeah, sugar or diabetes. We used to call it sugar. We still
Yeah,
call it
sugar.
sugar.
Yeah,
It ain't got nothing to do with Africa. They have everything to do with social determinants and racism that you experience all your life that wear you down, beat you up at the cellular level. So experiences that you're having in real life has a biological. You see, you feel the pressure. Sometimes you act out. Sometimes you get depressed or whatever. But it also has a biological effect on your body that you don't even see. It ages your chromosomes. I hope I said that right. Chromosomes.
chromosomes. Yes, you say it with the Trini accent, right? Chromosomes, Doctor
Yeah, yeah,
Kent.
yeah, yeah. Indeed, indeed.
Now
And
that you see, Akwatu, you giving me more ideas for shows now because now we really have to go have a discussion on this because it is so misinformation is so much, and I know Sarah and I have had these conversations. Sarah, Kathy Grant, and I've had the conversations about our history and the misinformation that is out there, and people just keep repeating it, and you're mixing the lies with the truth. Okay, so before we go, let's go back to the Black Scientist Task Force for a minute because you have some recommendations that you have made. And I think it's important that our community knows some of these recommendations and what you would like us to do as a community. So, um, do you want to go over some of those recommendations? You
yeah,
have
thank
them
you
in
for
your
that.
head?
Thank you for that.
You have
Yeah,
them in your
I
head?
appreciate
Okay,
that.
good.
So let me walk through them as I recall them, not in the order that they are in the report, but the
Okay.
order they are in my mind, so to speak. So the first recommendation, which actually speaks to our lived experience now facing COVID, is that the province and the city, mostly the province, because they're the ones who control the vaccine supply, ring fence vaccine doses for Black people, so that we don't have shortages again, which actually serves to fuel the missing the vaccine hesitancy, fuel the sort of disparity in vaccination rates across several postal codes, actually 9 postal codes, where there's about a 30% differential between the Black vaccination rate and the non-Black vaccination rate. It has to be closed because in those same postal codes are some of the highest incidents of COVID today as we speak. So we're facing the highest risk at in many communities in Toronto and across the province, and have the lowest vaccinated populations. And so those populations need to be vaccinated. In May, we actually started to get traction and reduce the unvaccinated rate. And people were coming out, but then the supply dried up, and all of a sudden we went back to the population-based approach that the public was taking, and we lose momentum. But we have to regain that momentum, and we have to make sure that all of these neighborhoods where there's a high rate of COVID
Mm-hmm.
are vaccinated well, right? And so we're asking for ring fence vaccines for Black people, so that we have Black clinics where people can go. You don't have to have a ID and all kind of thing, no big fancy thing, no big registration. They can walk in,
Right.
but you gotta show some ID so the system knows you've been vaccinated. But that's it.
Right.
That's it. You have to pay, and we want to have more Black clinics like we have one in Peel and in Durham and in Toronto. And we're having another one in the JCA in 2 weeks. So
Do you have the one for the JCA in 2 weeks? Do you have
the
the
3rd
date
and the
yet?
4th of July. The 3rd and the 4th of July at JCA from 10 to 6.
Okay. Okay.
There are Black doctors, Black vaccinators, Black volunteers. They're helping us out, making it a live Black affair.
Right. Right.
All right. And that's number one. And the city of Toronto has really stepped up to the plate on this. But we need the province to step up to the plate as well. That's number one. Number two is we want a mental health strategy for Black people in Toronto. We want a mental health strategy for Black people across the province. But because coming out of COVID, if we don't have a strategy now, we're going
Right.
to have huge problems then. Have a strategy now, begin the planning and the implementation now so we don't have a crisis post-COVID when nobody cares. Post-COVID, everybody moving on, dealing with, trying to cope and get ahead. And so do we. We need to be moving on. We don't need to be hamstrung by health burdens, mental health burdens, which are too much for us. So we want a mental health strategy to help us mitigate the risk and particularly protect our young people who have been hardest hit by these loss of school years, lockdown, loss of socialization and personal growth. I mean, it's huge. So that's one of the second pieces. Race-based data. We want race-based data in health. We don't just want race-based data on COVID. From now on, we want race-based data across the board. And when that data is collected, it needs to be analyzed. It needs to be reported in a timely fashion so that academic scholars, health professionals, people who are addressing our problems have access to the data and can do good work to protect the health of Black people. We also want, and I think I want to, so there's six. The third very important one is around vaccine sharing. Canada did not have productive vaccine production capacity, and so what they did was buy up a lot of vaccines, around the world, and they could because they have the income. So we actually bought up more vaccines than we actually need as a country. We have a lot of vaccines coming in. And what we're saying to Canada is that 15% of our oversupply, that's beyond what the population needs, should be dedicated to low-income countries and populations of the world. During the pandemic, now, they need it now because those mutations will multiply if we don't help them address COVID now. So 15% of the surplus in vaccines dedicated to the low-income countries of the world. And of that 15%, 25%, a quarter of that 15% should go directly to countries in Africa and the Caribbean. 75% of it should go to the World Health Organization's COVAX system so that they can distribute it in their own way. But those of us here from Trinidad and Jamaica and Haiti and Nigeria, Ghana, Ethiopia, Somalia, Tanzania, and Uganda, we want vaccines flowing right away to our relatives and family members who have zero access right now. And so we ask the Canadian government to make that commitment, pledge. And that's a very important one, I think, because it's about global vaccine equity. And so there's other things that we ask for. We ask the city to sort of extend its support that it's been providing to low-income communities, vulnerable communities during the COVID period for 2 years after COVID, because when COVID ends, many of us who've lost our jobs, lost our homes, lost our wealth, will still be scrunting and will need some support to get back on their feet. And it's not going to happen immediately. So just because the pandemic ends, that doesn't mean the suffering ends. So we want extended support for the segments of our population who have less support, who can't work from home and who working for $14 an hour, $15 an hour, $16
Right.
an hour to support a family on that. And that's why they have 2 and 3 jobs, right? And most importantly, for the current situation, I don't know about post-pandemic, we need 10 sick days for God's sake.
Mm-hmm. Mm-hmm.
Nobody's going to quarantine if they can't pay, if there's no money to pay their bills. I mean,
Yes.
it's a tough choice to have to make for people who carrying their families, and to expect them to decide, what, I could, yeah, go take a little lime and, get a couple of books, sit in my room. When you got bills piling up and your landlord threatening to put you out and cutting this and cutting that,
And the banks are not giving you a break.
right? So 10 sick days as a minimum.
Right.
Pandemic sick days. You need 10 days to quarantine properly. And you need to have that money immediately available to you. You got to apply and wait and all kind of thing. So 10 sick days now. But one of the things we're looking forward to in the future is transforming the SERB, which is the Federal Support Program,
Right.
the universal basic income for all Canadians. I think that's in terms of a long-term strategy,
Yes.
that's the only strategy that will avert a huge surge in poverty among Black people. We already have a large segment of our people living below the poverty line. We don't want to see that large segment get even larger still post-pandemic. And the only way to avert that is with a universal basic income, I think.
Right.
And
Right.
that's what we've asked him for. So yeah, so that's it. That's it.
That's some serious recommendations, and I put some of them in the chat so people, you can see some of them in the chat. I have dropped the link for the report, and you can read the report in its entirety in there. And if you have questions, be sure to send it, so that it can be addressed. And if you have information that you need to share to your community, you can reach out and talk to the task force if you need a town hall, if you need um, you know to put some meetings together. I know you're looking for ideas. How can the Black community basically help you and achieve the goals to what you need to achieve for that you've set out for in the Black Scientist Task
I
Force?
think you can write the mayor, write the premier, write the prime minister and say,
Hmm.
this is what we want. Write your member of parliament, write your member of the provincial parliament, write your city councillor. This is what we want. We agree with the task force on these recommendations. We want your support for these recommendations going forward. This is right on target as far as we're concerned. So those one of the best things you can do is write a letter in support of the recommendations to either the municipality, the province, or the federal government, and that will help. That will
And
help.
and is there anything else you want to say to our community in terms of their vaccine hesitancy and misinformation that we haven't touched yet tonight, that you think it's important that we share with them before we let you go get some rest, because you start in your day? What time? I don't even know what time you started in the morning.
Yeah, yeah, yeah. You know what? Your families need you. Our families need us. Our community needs us. Um, the best is yet to come. We have lost too many people. We are even able to grieve them properly.
Hmm.
Not just you, but me. And we don't want to lose anyone else that we don't have to lose, including yourself. So um, think about it. Those of you who, for various reasons, you want to wait and see what happens. You hear it's okay, but you're still cautious about,
Hmm.
will it work? Does it work? Will it harm me? Will I have an allergic reaction? Will it kill me? I can tell you, it won't kill you. You may be one of the 1 in 100,000 who have a blood clot, but even that can be mitigated. You understand? COVID will kill you. The variants of COVID will more kill you than the vaccine will kill you. Then you will have a severe allergic reaction to the vaccine. So that vaccine just loves the chronic conditions that we Black people tend to have in the Western Hemisphere. And even if you don't have it, the stress and the pressure of COVID is a burden for us in a way that it isn't for other people. I don't know why, but do all that you can to protect yourself, and that's what vaccines are, a means of protecting yourself. And always remember that it's a privilege we need to share with our brothers and sisters who live in less fortunate circumstances, have less resources. That we need to think about them always when we make our decisions, because what happens to them affects us, and what happens to
Hmm.
us affects them. Remember that.
Yes. Yes. No. Thank you so much, Akwati. And Somebody just sent me a little note in terms of mental health, and we have a lot of people who already are dealing with mental health and mental illness, and we have had, adverse side effects to medication. What is a suggestion that people can probably say to someone with a mental illness about getting them, and even the young people in particular, because I think some of them are in the same category of they don't want to take, they think they're invincible. Any thoughts on how we can share the benefits of taking this vaccine to young people who think they're invincible?
Yeah. So for adolescents, right? Adolescents 12 and up. Some of our adolescents are more physically developed than others,
Right.
So they're 12, but they got the body of an 18-year-old. They look they're
Hmm.
playing sports and all kinds. So uh, yeah, so their protection, um, the vaccine protects them. They may be more exposed, but for children under 12, they're very low risk of severe COVID. And for me, the big issue is should we be vaccinating children under 12 of low risk compared to our health professionals in Africa and the Caribbean who high risk? Like Uganda lost 8 doctors, and I mean that's a high risk occupation right now. And I mean, where's the best value for the vaccines? And um, to me, but I know that in politically that might not be a discussion that's taking place in our halls of governments.
Hmm.
But I think it should be a discussion. I think it should be a discussion that we should be having as a community, but it shouldn't be a discussion based on fears of conspiracies and all that. It needs to be a discussion based on the best use of the vaccines for people at risk, at high risk. The same way we are asking for ring fencing of the black population that's at high risk, why would we not ring fence the populations at high risk abroad?
Hmm.
Who may not even like this, maybe other things, maybe Mexican, maybe South Asian, maybe other things, because right here, Latin Americans right now
Yeah.
bearing the biggest COVID burden right now. So, um, yeah, we need to actually think about our fellow human beings that's facing COVID and see and think, should this be going to my 10-year-old, or is it better used for the 35-year-old health professional,
Right.
Brazil or Paraguay or
Right.
Uruguay or Uganda or Rwanda or wherever, who needs it now? Who needs it in now, today? That's, to me, that's a discussion that we need to encourage. That's a discussion we need to have. It should be an evidence-based discussion, not one based on fear and of the unknown or
Right.
misinformation about the vaccines, because we are fully aware now of all that went into the vaccines. We know that they're relatively safe. Even the AstraZeneca is relatively safe, and we want high risk people wherever they are to be vaccinated, because we've seen how good they work in the long term care homes. Remember a few months ago, death was every long term
Everywhere.
home was like a death
Everywhere.
sentence.
Everywhere.
Now, not so much because people are vaccinated. Now,
So it
actually,
tells you it's working. It's working.
it's working. And
Yeah.
the problem is there's a lot of people working in those places who are not vaccinated, and they're the ones who getting COVID and getting sick and dying from COVID. So that's where we are right now. But I think it's a global pandemic, and we need to think of it globally. And
Right.
black people are global people. We nobody, especially the black population in Canada, which is largely a significance. We're much more from other places, likely to be from other places than the black American population. So we are very globalized, and we need to put on our global lens when we talk about COVID and vaccines. Why vaccinate a group of people under 10 years old, low risk of severe COVID, very almost zero risk of dying from COVID, when we got people who had 40% risk, very high risk of dying from COVID? Why wouldn't we vaccinate them?
Exactly. Exactly. It
Very
blows
much.
it boggles my mind. And I don't know if will the task force be looking at some of the vaccines that are coming into the Caribbean and other parts, of where we reside, that are not AstraZeneca, not Pfizer. not Moderna? Are they looking at some of those? Because I know there's a lot of questions coming out of even just out of Trinidad, where they call it whatever they, I don't even know the name of the vaccine, but it's a vaccine that I don't know the name of, that is there, and there's a lot of information, and I don't know if it's misinformation, but is a task force going to look at some of those questions and concerns?
Well, that's not within our purview, but
Okay.
um, I could tell you that you know, yeah, yeah. Again, we shouldn't be choosing a vaccine based on misinformation or ideology.
Right.
And when you pick a vaccine, you need to be able to see the data from the clinical trials that shows how well the vaccine worked in clinical trials and how well it's likely to work in reality,
Right.
effectiveness, right? And um, if the vaccine producers can't give you that information right away, then you have to be cautious about that vaccine.
Okay.
And one of the things that I know is that certain vaccine producers aren't haven't fulfilled due diligence on the vaccine information. However, I know that uh, the World Health Organization is actually in the process of approving. There's 79 vaccines under development or in clinical
Oh,
trials. There's a lot of
wow.
vaccines around the world, right? Cuba has a
Wow.
vaccine. There's a lot of vaccines under development, and I think the best um, mechanism is the World Health Organization to
For
check
the
the
information.
vaccines.
Okay.
And one of the things they're looking at is vaccine passports for approved vaccines. So the question is, what's an approved? So are we just talking about the 4 vaccines? So if they put in place vaccine passports, will it be just for the 4 vaccines that's approved in Canada? What happened to the Soviet vaccine, the Russian vaccine, the Chinese vaccine?
Right.
I mean, the Cuban vaccine. I mean,
So how is that going to work? It
how's
it
that going
is
to work?
Yeah, it is a
And,
conundrum.
and I know the African Union is buying a lot of Russian vaccines, a lot
Hmm.
of Chinese vaccines. So a lot of people getting those vaccines, and it looks like they may not be considered fully vaccinated for vaccination or immunization card. I mean, what does that mean? But part of it is the fault of some of these vaccine producers who haven't secured WHO approval for their vaccine because they've been hesitant to share their data openly with the world, and that's something to consider, right? So,
Okay, well that's good to know. You're giving us some food for thought. Well, I can't let you go without asking you a couple more victory questions as we wind down. We're gonna end it on a lighter note. What are some of the
right.
lessons that you have learned for yourself along the way that is propelling you forward into being a Kwatu that continues to advocate for the community? What are some of those lessons along the way that just fortify you, Akwatu?
But the benefits of serving others come back to you. Now, normally, my philosophy is I want the benefits to come to my children. That's my
Mm.
philosophy. But I could say that my mom. It was a surprise to me. She canceled her vaccination appointment. She's 80. She got heart disease. She high blood pressure. She's like a walking COVID magnet. I mean,
Right.
So, and she's 80, 82. She cancels her appointment in March. She cancels it. So I call her, I check in, and just check on and say, how you doing? How was the vaccine? She ain't getting no vaccine. She decided she ain't want no blood clot. Hey, so my natural instincts, and this is the
Right.
you'll always learn new tricks. My natural instincts would have been to say, because my mom and I, look, you getting a vaccine. I ain't want to hear nothing from me. I want to hear nothing about you. You get, no, I didn't do that.
Right.
I did what I tell people to do. I listen
Hmm.
and I say, Mom, you know, the chances of you getting a blood clot even from AstraZeneca, you likely won't get the AstraZeneca vaccine, but the chances of you getting a blood clot is very low, almost nil, because you're in your 80s. So you're not at risk. People who are under 40, women who are under 40 are more at risk than women over 40, and you're 80. So, but even so, you're probably getting a Pfizer vaccine because you live in Ajax, and that's my understanding. That's the vaccine that's available,
Right.
and that's perfectly safe for you because there's no virus in the vaccine. So you don't have to, it's not gonna knock you out and put you at risk because you have a
Right.
immune system that's compromised because of all these challenges you've had, and plus your lungs, you have weak lungs. So I actually talked to her about vaccines the way I tell
Right.
other people to talk to her about vaccines. And had I not gone through this process, I might have been more harsh and talk to her the
Mm,
way she talks to me.
right. Right.
I didn't do that. I talked to her gentle, and I said,
Yes.
"You know what, Mom, it's your decision. I understand that, but you know what? We love you. We need you. We don't want any take any chances. And you might, she said, I don't go outside. It's hardly go outside. What I don't worry about. I go bounce up COVID. I said, COVID could come looking for you. You had to go looking for
Right.
COVID. COVID looking for you.
Right.
Look here. I hear that heart disease over there, high blood pressure over there. What? I want that. That's COVID looking for you. And so I
Yeah.
use that same approach, and it worked. She got vaccinated. Now she's double dose, so she's good to go.
No, that,
And
oh, I like that. That was a that philosophy, man. Philosophy. So
yeah,
20
so
years
that's
from now, 20 years from now, you look back on your life. What do you think will matter to you most?
20 years.
20 years, at least 20 years from now.
What will matter most when 20 years from now is how my children are conducting themselves in the
Mm,
world. I want my children to feel as though this world is theirs. I want them to know, as children of Africa, um, they have to always be proud of being African. But that doesn't mean that the only people they interact with is Africans. That
right.
doesn't mean that they don't have non-African friends
Hmm.
or they can't marry people from other cultures. It only means that they are responsible for their culture, and the way they live, others respect them for it.
Hmm.
Others know that if they throw out anything, they can respond. If opportunities arise, my children will grab it. Nobody has to say, your self-esteem is this or your self-esteem is that. Their self-esteem is intact. Their cultural esteem is grounded,
Mm.
you know, and are you black? Are you African? Of course. Why would you even doubt that? I know I'm a Canadian, but I'm an African. I was, that's my faith. I was, God has protected me, my African identity so I could come through so many hundred years of slavery and second class citizenship and still love my Africanness. I want that's with my children. I like that. I feel very good in my grave.
I love that. I love that. And so, you're on the Victory Speak show. So you can't leave Victory Speaks and don't tell me what victory means to you.
Yeah, well, victory means to me that um, no one will say, boy, Akwatu screwed me, exploited me, oppressed me, take advantage of me. Um, when in ancient Egypt, you used to have to do like 137 negative confessions. I didn't do this. I didn't do that. I didn't do that. So
Hmm.
I don't have to do 137. But I know leaving the world, only one or two people could say, boy, that Akwatu is a real jerk, in the thousands that I've met.
Right.
And to me, that's the journey I've been on. That's the journey I want to end on. That I say, boy, I've lived a good life. I ain't do nobody nothing. And anytime I was saying I have a 25 cents and a man asking for I forget what he used to say, a shilling, you share it. You understand?
Yeah, right. Right.
With that, I'm guaranteed a afterlife, as the ancient Egyptians used to say. And so that's good. That's what I want.
I love
That's my
it.
victory. Victory in the afterlife because
Victory
I've
in the
lived a good
afterlife.
life in this life.
Yes, I love it. Dr. Akwatu Khenti, fellow Trinbagonian, fellow Canadian, an advocate. I salute you. I thank you. I thank your children for allowing me to have you on the show tonight.
Yeah, come. They're here waiting in the wings for
They're
me.
waiting to say they're waiting to say hi. We have to take a picture after the show, so make sure you stay there.
Yeah, they're
So
waiting for
glad,
me.
so happy to see you and allowing me to have your daddy on tonight. And for those of you live and on the replay, we thank you for
To go.
tuning
I'm
in
coming up. I'm
to
done.
this conversation. It has been an awesome pleasure to have Dr. Akwato Kente here with us tonight as we talk about COVID-19 and vaccinations and the Black, Scientist Task Force here in Toronto And you can listen to the show again if you missed any of it. And if you need to share it with your friends, it's going to be on YouTube at Victory Speaks 7. It's going to be on Facebook at Victory Speaks 77. And we totally appreciate you. We have some of the links are in the comments that you can go and you can pull it to go and read the task force, their recommendations. And we encourage you to contact your members of parliament, your members, your MPPs, your MPs, let's not leave out the senators, even though people are going on vacation. This is a time that they have time to read, and they really need to take these recommendations seriously. We really want them to pay attention because we've come so far and we cannot go back. We need to move forward. So thank you so much for tuning in. Thank you for your patience and your kindness. And remember, we need to take care of each other. We need to be well together. It is our mental fitness and our physical fitness, and I am Nicole Waldron, your voice of victory, your mental fitness coach. And on the weekend, on Friday, you can find me on Speak Up and Empower with Coach Lovemore at 7 p.m. And we will be speaking with Sanaj. And on Saturday, I'm actually hosting an event that is a scholarship event from Dottie Nichols. And I'm going to put that flyer up. So if you want to attend by Zoom, that she's giving scholarships to young people. And on Monday, I have Sherma Andrews coming out of Trinidad and Tobago. She's going to be on the show live and direct on next week, Monday. And on the Wednesday, I'm going to have a show with fathers, the barracks fathers, the clan. Some of them are coming on. So be sure to tune in. And I appreciate all of you. Thank you. Have a good night. And remember to speak victory and let your victory speak. We're out.